Hello, everybody. I'm Grant Boxleitner. Welcome to Local Doctors on Call. I'm joined by Dr. Stephen Wrench and Dr. Brandon Fuller of East West College of Natural Medicine. Gentlemen, welcome. And in this first segment, I want to talk about choosing Oriental medicine for trauma. And so I just want to know for patients, how do you know whether to go to a Western medical doctor or an Oriental medical doctor? What's the difference and how do you make that decision?
Well, I think generally the first thing we would think about is how painful is it? Let's take a scenario. You sprain your ankle. You can't bear weight on it.
Right.
You can't walk on it. I think that's pretty much a no-brainer. We do the same thing. We would probably check ourselves into Sarasota Memorial and get some imaging work done to find out, do we have a fracture? Do we have a sprain? If so, what the severity of the sprain is. So I think one of the things we would go by is the pain level. The second thing is, have we lost range of motion? You know, how debilitating the injury is. I think you know that. And if it's not a trauma, if it's just like, let's say I have abdominal pain, I think the severity is really the number one factor. Remember we talked about before, your body communicates with you three ways.
Right.
How you feel, and by form, changes in physical form and function. So I think most of the time we know. Sometimes you could certainly have a minor injury, not know it.
Yeah.
And you're walking on an ankle that actually has a hairline fracture and things like that. We say when in doubt, get some image work.
So as far as the Oriental medical doctor scenario, give us a couple of instances or examples when that would be appropriate.
So as we know, there's the Olympics going on, right? And for those who are athletes, sometimes they go running and they hurt afterwards, they ache afterwards. Sometimes they might have a mild sprain or strain. That's when they can come to us and we can work with them, do some orthopedic evaluations, figure out if they need to go get imaging.
Right.
If they don't, then they can get some acupuncture or some herbs or something to help ease that healing and make it a little bit faster for them.
Yeah, absolutely. And is it mostly preventative, or do you also treat serious conditions?
It's actually both, Grant. It's a cultural thing where this medicine actually originates, of course, in China.
Right.
Thousands and thousands of years ago. It was used as a preventative measure. Mm-hmm. But we're of a mindset in this country to, I'll go to the doctor when it gets bad enough. And we're all too guilty of waiting sometimes, putting things off and waiting.
Until the pain is so bad where you feel like you definitely have to take action.
Exactly. So for us, we think of preventative medicine, I think, in this country as, well, I exercise and I eat right, and I get plenty of rest, so that's my preventative. And perhaps at another time, we will talk about how this works as a preventative measure, but it certainly is both, before and after the fact.
Yeah, and Dr. Fuller, anything you'd like to add on that?
Definitely with the traumatic injuries, we can do preventative work, specifically also after somebody's had a traumatic injury and needed to go to the emergency room. So think of a heart attack per se, and they had to have open heart surgery. They can come to us afterwards and we can do acupuncture to help the body heal and then help with preventative measures for later on down the road.
Augmenting the other protocols.
Exactly.
That's correct.
Yeah.
I see. All right, so what are the different types of treatments you can do for somebody when we're talking about a traumatic event? You just mentioned one of them.
Well, I think one of the things we would do, certainly is because it's kind of in our name, is acupuncture.
Right.
And we would treat specifically for points that are correct for that particular trauma. As Dr. Fuller mentioned earlier, we can speed up the healing process to some degree.
Okay.
And that's why you're seeing more and more athletes get this, because their livelihood and their career are one and the same. So these guys, if they can't get on the field, they can't play, and so their career's affected. In fact, if I may, everyone's buzzing about Michael Phelps and what a great job he's doing.
And we're certainly going to get into that in the next segment. We're going to talk all about cupping therapy.
Okay, well, just because they're out there in the limelight, you're seeing athletes, you're seeing actors, you're seeing famous people having these treatments, and everybody goes, wow, guess who's getting acupuncture now? Most of these people have been doing it forever because they're big believers in it.
So it spreads word of mouth, and then all of a sudden...
but again, when people say that, well, that's news to me, we say, well, it shouldn't be. It's been around for 6,000 years.
Right.
So, whether or not you've had an experience with it, it's an individual thing, but we just say it's been around forever, and we will talk about that a little bit more.
Yes,
and
looking
look
forward to that.
Yeah.
And don't go away. More Local Doctors on Call right after this.
I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. In this segment, gentlemen, we're talking about adjunctive therapies for trauma, and I just want to know, what is moxibustion?
Well, moxibustion is the burning of a therapeutic herb on or near the surface of the skin. It's actually a member of the chrysanthemum family, and its botanical name is Artemisia vulgaris. Now, of all the herbs that are out there, the ones we know about and even the ones we don't, this is the only one that's ever been found to have a therapeutic value to the degree that it does. So by holding it near the skin and warming certain areas of the body, we can expel what we call cold syndromes in Oriental medicine. We can move healing blood, nutrient-rich blood and energy into the area, and we can actually alleviate pain.
Wow, so just from this one herb.
Yeah, it's pretty amazing. It burns at a temperature of 670 degrees, and what's cool about that is it never combusts, which is actually a very good thing if you think about it in a clinical setting. But it actually has the ability to warm. So let's say a person has pain in their joints and it's worsened by cold. By applying Moxa just near the surface of the skin, it's not unlike burning, it maybe looks like a cigar.
Okay.
Something
so it's
like
about that long? Or
they can be. Of course,
okay.
they burn down like anything, but there's different methods of using it. But one of the most commonly used ones is just looks like I call it a big cigar, and we hold it near the skin and we move it around the painful areas. Patients love it. It really works, and it's been, again,
So
it predates acupuncture.
Is it an instant relief, or do you kind of do you have to put it there for a while, or?
Yeah, we would have to be there for throughout a session. It may be there
Okay.
5-10 minutes,
I see.
and you would have repeated sessions like anything. But in the case of, as we said, cold that is hindering the movement of a joint or causing pain, the relief can be almost immediate in some cases.
Very interesting. All right, so we've heard a lot about this with the Olympics going on. What is cupping therapy? Of course, Michael Phelps and even members of the U.S. men's gymnastics team, we've seen those welts or bruises on their backs in most cases. Tell us about this.
Well, cupping's been around for thousands of years, and it began, we understand, historically by using the horns of animals, which were a perfect vacuum.
Okay.
And so they would introduce a flame into the horn, place it on the skin, and in that period in history, they were using it more at the time for removing pus from a festering wound. And then they found other uses for it.
Right.
And today we see, as, thank you, Michael, and congratulations, by the way. But we see that the athletes are using it, as they have for centuries,
Right.
To move blood that's not circulating. We call it ischemia, blood starvation in a muscle group.
Right.
So when anybody that works out or exercises or even has a trauma, as we mentioned earlier, has soreness and achy joints and muscles, we use cupping quite a bit to move blood.
And you brought a sample with you. I just want to show this.
We actually
is that
did.
a piece of that's exactly what you'd put on the skin, right?
It is. It's just a little glass jar. Looks a little, not unlike a little fish bowl, we might say. And there are different sizes. We would just call this a medium cup. But again, we take a flame, we introduce it, we place it on the body,
Right.
and it can be used in a stationary fashion, or it can be actually moved. It draws the skin up. It's not uncomfortable. Patients love it. But one of the things that we notice is that athletes are using this. I might mention too, Tom Brady, everybody knows, the quarterback of the
Right.
Patriots, actually is a part owner in an Oriental medical facility, and because he's such a believer in it. And so sports enthusiasts use this all day long, as you saw with Phelps. And
Yeah.
and I'm just going to throw this out there, but cupping, gold medal, cupping. I'm just saying.
Yes.
I'm just saying. Do the math, right?
And Dr. Fuller, you don't have to be an athlete to use cupping therapy, do you?
You don't, actually. Many patients come in and they go, oh, my back hurts a little bit. I went to bend and pick something up and I felt a little, twinge.
Yeah.
And then they'll come in and they'll receive acupuncture and we do a little cupping at the end also. And it relieves all that stagnation or that blood that's kind of sat in there trying to heal.
And so with the capillaries, if that bruising takes place, that's cosmetic pretty much.
Well, that's actually a good thing, though. When we see, like as with Mr. Phelps, and we saw the dark circles, and
Right.
kind of all of America goes, oh, what is it? It's actually, we look at that and go, great, great. That's a good result, because that blood that isn't moving moves up to the surface by way of suction. So in a way, when you think about massage, Grant, it's always kind of down and into
Right.
the tissue. Cupping actually pulls up and away from the body. So it kind of gets blood that's not circulating kind of back into circulation. And when it gets sludgy when it's not circulating. So this is one way to do that.
To pull it, to pull that skin up and get things moving. All right, well, don't go away. More local doctors on call in a moment.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
I'm sports anchor Trevor DeGroat. Join me this season for the Suncoast's hottest prep sports show, Friday Football Fever. Highlights, scores, and breakdowns of all the local teams every Friday night starting August 19th, right here on the Suncoast News Network.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Welcome back to Local Doctors on Call. I'm joined by Dr. Wrench and Dr. Fuller. Gentlemen, we've been having a discussion talking about adjunctive therapies for trauma, and you were talking about cupping therapy, and there was a point that you were trying to make.
Yes, exactly, Grant. One thing I did want to mention, I know a lot of people actually can purchase cups and do them at home on their family members and themselves.
Right.
One thing just that we want to say that you would never cup over arteries or large vessels, and you would never cup over broken skin, and you would certainly advisedly, so never cup on the abdomens or low backs of pregnant women. And when you buy these, they don't tell you that, so
Right,
I'm telling you that.
Yeah,
Okay.
just some of the risks
just to be on the safe side, yes.
Yes, from the expert. All right, so I want to ask, what is laser therapy? What is
Go ahead and
laser
take this one.
therapy?
Well, laser therapy's been around since the 60s, but really more as an adjunctive medical treatment since for about 20 years. And we use at the college, like a lot of clinics use, what's called cold laser, or LLT. It's low-level laser therapy.
Okay.
It's called cold because it's athermal or non-heat producing. Now, in 1968, there was a guy named Andre Meister in Hungary that did laboratory testing with rice. That's half rat and half mice.
Yeah.
But and what he did was he implanted tumors in these rodents, and then he stitched them up. And his idea was to vaporize the tumor with the laser.
With the laser.
Well, the lasers hadn't developed to that degree yet. But what he did find out, while it wouldn't vaporize the tumor, what it did do was it caused the incision and the surgical closure of same to heal much faster. So what we now know today, that lasers not only are very therapeutic in that they they amp up the body's metabolism of every cell. You have what's called a mitochondria.
Yeah.
It amps the cell's metabolism up. That speaks directly to the lymphatic, the central nervous, and the vascular system, which creates a healing environment in the area. The other thing that Meister found out, it aids with slow healing wounds and fractures up to 60%. So it's a wonderful addition to a therapeutic treatment.
All right, and so another treatment in these therapies, what is Tui Na?
So Tui Na is like the Chinese form of massage therapy. And it's a little different in the way that we use. It's not like going and getting a Swedish massage for relaxation. We use this more for healing and certain medical conditions. And included in this is bone setting, which isn't that much different from chiropractic care. Now, primarily, bone setting is used in China. Right, and Tui Na we can use here, and we do quite a bit of that. And we press different acupuncture points, similar to shiatsu and that sort of thing. But it's used a lot to help loosen muscles or to help strengthen different areas that may have weakened.
We might mention too, when we say bone setting in this country, we're thinking about I have a fracture, it needs to be put back into its proper place. While they are experts in that field, when they say setting, they also mean, like a chiropractor, that as we move 206 bones around through a normal day, things get out of place. So setting in that realm is to simply make sure it's where it's supposed to be.
Make sure it's aligned.
And we're talking exclusive of fractures, although they can treat that too. So.
Okay, interesting. And don't go away, more Local Doctors on Call right after this.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back August 19th. Keep up with the teams from across the area.
And I'll be on the sidelines of the Game of the Week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Can't get enough Friday Football Fever? Watch Thursdays as we preview the Game of the Week. We'll take a look at the week's biggest matchup, and if that's not enough, Friday we'll be live from the game to hear from players and coaches.
Playing fast, playing physical.
You won't want to miss it.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. And in this segment, I want to talk a little bit about herbs. Of course, that's a big focus over at the college. And are there different types of herbs for pain and traumatic injuries? I know that it runs the gamut. You have a lot of to choose from.
There are. So some that most people know is we use a pill form or a raw form, and it makes a tea. But what many don't know is that we have liniments, kind of similar to like a tiger balm, you might say, where you can rub it on, and it helps bring blood flow to the area and heal areas that have been injured or damaged. We also have what's called a ditta, which can be eaten, or we use it a lot as the liniment again. And then we have plasters that we can place on. So these plasters feel similar to like an icy hot patch.
Okay.
But they're packed with herbs which help bring that blood flow or do what we need it to do.
And you mentioned this
cases.
Dittau liniment. What does it taste like?
Well,
How would you compare it, I guess, for folks who aren't familiar?
have you ever tried ditch water? I'm just saying. No, I'm kidding. If you think about you were a kid and you had castor oil, what didn't taste good, but the Chinese have a belief if it tastes good, it's not doing what it's supposed to do. So it's medicine. Chewable Dittau is a trauma-based form. It comes in a pill form. You don't chew those. There's a little chewable type. Looks like a kind of a little, if you took a Tootsie Roll, roll it up in a little ball.
Okay.
And it is chewy. It's not unpleasant. I've had it often. It's not unpleasant. But it's an internal healer. So we can apply it topically, or you can, in the case of a real severe trauma, you blew out your knee, you sprained your ankle, you had a fracture, you take it immediately, and it begins to speed up the healing process. It's been around, again, for thousands of years, and it's very effective.
And would this be a regimen that you would take over time, or would this be a once?
Over time, but as per needed. As things start to heal, probably the most critical time, let's say a fracture, in the first, say, 3 to 4 weeks.
Yeah, definitely.
All right. Well, don't go away. We have much more Local Doctors on Call after this.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Highlights, scores, breakdowns of all the local teams every Friday night. What more could you want? Friday Football Fever, the Suncoast's hottest high school football show, is back August 19th. Keep up with the teams from across the area.
And I'll be on the sidelines of the game of the week every week, bringing you interviews from coaches and players from Southwest Florida's biggest matchups.
All the Suncoast high school teams, rivalries, and action, we've got it all right here every Friday night on the Suncoast News Network.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental Medicine.
Welcome back to Local Doctors on Call. In this final segment, gentlemen, I want to talk about clinic experience. When you go over to the college, what would you expect at the clinic there if you came in with an injury? Does it start with, I guess, just a basic checkup and move from there? Give us a sense. Take us through it.
So if per se you came in and you injured your knee or twisted your ankle, you would come in and we would take a look at you. We'd ask you a bunch of questions. We'd do some orthopedic evaluations, ask you how it happened. If you were having trouble putting weight on it or you couldn't move it, something like that, we would then say, okay, you need to go get imaging done because this doesn't look good.
Right.
It looks like you might need a surgery or you might need to get your ankles looked at. And then after that, we can help you heal and work in the healing process.
So once you're back at that setting, you've gone through the questionnaires, then what happens?
Then we go with acupuncture, herbs, cupping, moxibustion, whatever.
All of the techniques
all
we've
of
been
the
talking
different
about.
techniques we've been talking
Whatever is right for you.
Yeah.
But in the case of the trauma patient, number one, we want to find out where the pain is and what is the mechanism of injury. Number two, is there a problem with instability, as in the case, as you said, I can't bear weight on it. Is there a loss of range of motion? I cannot move it. And the fourth thing is there crepitus or noise where there shouldn't be, as in the case of a fracture? We get a little grinding or something. So these are things that if we get, these are red flags, and these would indicate or necessitate imaging, x-ray, etc.
And then so the herb regimen, you'd go over those scenarios as well?
Those would also come into play at the end of the treatment. Then we could put a liniment on, put a patch on, and talk to you about herbal prescription that you
And
need.
of course, you have a whole pharmacy over there where,
We do.
where folks can look at that, and there's guidance provided for that.
Correct.
Now, can patients get concurrent treatments while receiving acupuncture? I think we've covered this, but give us a sense. If you're taking acupuncture, can you take advantage of the other services?
Definitely. So a lot of people nowadays will go to their Western primary care physician, like a cardiologist, and they'll be talking about, can I get acupuncture? Can I go receive any other types of treatments after my open heart surgery? Or, I just had surgery on my foot. I'm a diabetic. I take insulin. I take all these medications.
Right.
Can I receive acupuncture? And yes, you can. Right? It works concurrently with Western medical practitioners, and it does a great job.
Just another approach to use in healing.
It's never contraindicated. As long as people are open to it and understand the efficacy of the treatment, there's never a time that you shouldn't receive acupuncture.
So, yeah, no matter what you're dealing with or condition,
Absolutely.
it is going to be beneficial in some way.
Definitely.
All right. So tell me a little bit about the college for folks who have never been there. Where are you located? Give us a sense.
Well, we're right down the road here. We're at the corner of Myrtle and 41. We've been in Sarasota for 20 years. We've been in this location for about 13 years. And we are a medical training facility for acupuncture physicians. And we also have a student and professional physician clinic. So if you want to receive treatment at a reduced rate, you're treated by student interns in our student
Right.
clinic or by physicians in the professional clinic.
So if you want to take advantage of your professional services, or you want to maybe someday become a Dr. Fuller or a Dr. Wrench, that's
Well, I
where you
wouldn't
can start
recommend that at all.
That's where you can start that process.
Those jobs are taken. I'm just saying. Yeah, absolutely.
Jobs are
Absolutely, you
occupied.
can. And the phones ring quite frequently, and people are curious about that. And we hear the same thing. I've thought about this for a long, long time. I feel like this is something I'm supposed to do or I need to do. So we
Right.
say, come in, meet our president who's with us today, give you a tour of the facility. You'll get all the particulars. And if it's something that you've thought about and it's staying with you as it did with us, then it's probably something that's calling to you and you need to look into it.
And we are running out of time, but you have a very important veteran event coming
Just
up.
real quick.
Talk to us about that.
Absolutely. I just want to say this to our veterans. Number one, thanks for your service. Number two, on September 24th at the college, East West College of Natural Medicine, we're having we're treating veterans from 10 o'clock in the morning on I believe it's a Saturday, and we're treating all day long, and there's no charge for veterans. So please come take advantage of it. We'll do the best we can for you guys. You sure did for us. Thank you.
All right, gentlemen, and thank you. And that does it for this edition of Local Doctors on Call. See you next time.